And good evening, everyone. And welcome to this episode of the Ask Dr. MJ. Why? Because your health is important. Facebook Live, Instagram Live, all social media live, and on YouTube. Thank you for tuning in because we know you have other things you could be doing, but you decided to party with us tonight. And we are so glad that you decided to do that. We got some great topics we're going to introduce. But of course, this is the People's Show. So whatever your question is, we want you to start getting into the chat. And we're going to answer questions online as well as in the chat so we can get this conversation started. So thank you once again. And for all the people that have tuned in, all the people that have subscribed to the YouTube channel, AskDrMJ. Thank you. Humbly, we thank you. But we want you to tell all your friends. We want you to tell all of your friends because the more people that we share this information with, the healthier we will be as a community. And our objective is to share healthcare information that's unavailable in other places. Oftentimes, even if you're going to the doctor, again, the model is to spend 7 minutes per patient. So there's no time for conversation. There's no time to answer questions. They get you in, they get you out. They order every diagnostic test known to man. You don't know why you got it. It's just absolutely incredible. So thank you once again. If you got friends that you think would benefit from tonight's broadcast, just send them a text right quick and tell them to go to YouTube, Ask Dr. MJ, or any social media, including the Lipodrops website. There's a link. If you go to lipodrops.com, you can go to a link and you can join us live right now. So let all your friends know, let your family know. They can tune in. And then every time we do this broadcast, we want to do that. So it's Wellness Wednesday, as you know, and this morning on the Rickey Smiley Morning Show, we talked about smart devices and the use of smart devices to monitor your health, to improve your health. So everybody's familiar with the Fitbit and the first generation smartwatches. This technology is now about 15 years old. Wow. Boy, I tell you, we aging great. So 15 years ago is when you first started counting your steps, and everybody's goal was to reach how many steps? 10,000 steps. So if you could get to 10,000 steps, you were going to be a healthier person. And that is absolutely correct and continues to be correct in reference to that. So we want to make sure that for people that are using the smart technology, because this technology has come a long ways. It's far beyond just counting your steps now. So it can have a big impact on your health. Nearly 1 out of 3 people are wearing these smart devices now, smart watches. They are wearing the either the Apple Watch or the Android brands. So those are the ones that can give you what you're looking for. There are no name brands that you can get for as little as $40-$50 that will give you some of these same benefits. So we call those and consider them consumer grade smartwatches. Consumer grade smartwatches, and the accuracy of the information that you get varies depending upon brand. It's not necessarily dependent upon price. Some of the better models are the least expensive models. Now, medical grade wearables, however, have FDA approval and they have a high accurate dimension. So you'll know. The most common phenomenon now with medical grade wearables are the continuous glucose monitors. The 2 most popular brands are the Dexcom 7 and the Freestyle Libre 3 Plus. These are both about the size. One's about the size of a dime, another one's about the size of a quarter. You wear them on your arm here, and it connects directly to your cell phone so that you wave your cell phone and look at it, and it tells you exactly what your blood sugar is at that moment in real time. So no finger sticks required. No other technology, no blood draws required. It just gets that, and it's very accurate. And so how do you use that technology? For patients that are type 1 diabetics and type 2 diabetics that are on insulin, this is very important technology because all you do when you're on insulin is chase your blood sugar. When it's too low, you eat something. When it's too high, you take something to bring it down. So there we go. So when we're doing that, that information that you find out is very important because you learn foods that you thought might cause your blood sugar to go up don't affect your blood sugar at all. Or foods that you thought were benign shoot your blood sugar up, such as all of your juices, your fruit juices, your apple juices, your orange juice. Orange juice is used as a rescue when people's blood sugar is too low. You give them a half a glass of orange juice, that sugar will go up 100 points. So that's where you are when you're doing that. So when we're doing that and we're talking about that, we're going to talk about the smart watches, etc. So They can monitor your basic heart rate. They can monitor even your stress levels. But most importantly, they can monitor your heart rhythm. And so if a patient has atrial fibrillation, everybody's hearing about atrial fibrillation. They got 1,000 commercials on television now about AFib, AFib. Well, the problem with atrial fibrillation is that instead of your heart pumping like this, lumped up, top to bottom, the top starts to fibrillate like this, and so blood isn't moving forward. And when blood doesn't move, blood clots very quickly. And those clots, little small clots, big clots aren't as big a problem. Small clots that go through the vasculature and plug up either the arteries to your brain or the arteries to your heart and cause heart attacks or strokes. So that's why atrial fibrillation can be a real problem. When your heart is fibrillating like that and it isn't pumping blood that's coming back from the lower part, it goes all the way to the tip of your toes and then comes back to your heart. It's passively moving forward, but it's not moving forward with authority. And when it passively moves forward, there's the potential for clot formation. So it's very important that those watches can give you great information. But one of the things that I learned is that the smart rings are even better. You see these on the internet. If you go on the internet, you're on any of the sites, they pop up, they have little pop-up commercials about these rings. Well, these rings are great and they are even more accurate, and which is a kind of amazing, but they're more accurate because this side of your hand versus this side of your hand. This side of your hand has pigmentation, and the pigmentation, the darker it is, the worse and the least accurate the information is, particularly on a wrist watch, because it's only pigmentation. But on your palm, this side you put a ring on, then this side has no pigmentation. So it gives you great and very accurate information no matter what your pigmentation level is. So a smart ring, it can even monitor your sleep, how well you're sleeping, how deep you're sleeping, etc. So all great health information in doing so. Okay, Hylick, that's our start. Let's do our roll call and see who's on. I saw Makiba Boland on there already. So let's go down the roll call list. Okay, I see Val D from Jacksonville, Florida. Hi, Val Duval. Glad to have you in the house, darling. Thank you so much. Big Time G. Good evening. Sean Big Time Green from Monroe, Louisiana. Sean was my very first male and was early on. He's been with us from the very beginning. Thank you, Sean. Glenda Everett. Good morning from Warner Roberts. Thank you, Miss Everett. We appreciate Warner Roberts being in the house. Lynn F. from St. Louis. Lynn is returning. We appreciate you, Lynn. Thank you from St. Louis. All right, Patrick White. Good evening, fam. Thank you so much. We appreciate you being here, Pat. Okay, Makiba Boland, good evening. We acknowledge you already. I saw you in the chat, and we're going to get to those questions over there in just a second. Okay, T.I. Penelich. Okay, Diane from New Jersey. Hi, Diane. Thank you so much for tuning in. We appreciate you as well. Okay, so we're going to, okay, hi, Alice Allen. How you doing? Real men spoil that woman. Yes, we do. And I like to do so. Angela Wright from Columbia, South Carolina. Hi, Angie. We appreciate you as well. Thank you. Alice Allen from Chicago. Thank you, Alice. We appreciate you from Chi-Town. The Midwest is in the house. I hope the weather's good up there now. Sharita Ward from Florida. Hi, Sharita. Thank you so much. We love Florida. Want to go down there some point in the next few weeks. Okay. All right. So, hello, Dr. Kaya. I'm on Humira injections. Hello, Fort Stewart, Hinesville, Georgia. Humira, great biologic. We'll talk about that. Latricia Reese. Good evening, Latricia from Austria, Georgia. This is the first. Okay, Tanya T. Good afternoon, Tanya. We appreciate you from Texas. And she's on YouTube as well. Thank you so much. We appreciate you. Marissa Jarrett. Good evening from Flint. Thank you so much, Marissa. We appreciate you for joining us this evening as well. Shamika McAllister Hull. Can you see me, Shika Hull from Atlanta? Hi, Shika. I sure can. No problem. Thank you very much. We appreciate you. Marissa Garrett. Good evening from Flint, Michigan. Thank you, Marissa. We appreciate you for being here as well. Vanessa Spurlock. Hello, Atlanta. YouTube. Thank you, Vanessa. We appreciate you as well. Okay, so now, once again, we've reached a milestone in our YouTube subscriptions. We want you to thank you so much for being a subscriber. If you are on right now and you haven't subscribed to the YouTube channel, please subscribe. Doesn't cost anything. It's just pointing and clicking. And that way you'll get notifications and we'll let you know when we're having live presentations, because we do the live at 6:30 p.m. Eastern Standard Time on Wednesdays. However, if there's a medical question that's coming up, and we're going to have a lot of questions coming up very soon about the flu season, the coronavirus is rearing its ugly head again, we're going to do that. All right. So Jimmy Toussaint, Hey, Linda Bloomer and Valerie Douglas, thank you so much for tuning in as well. So thank you. I humbly express my appreciation for you being a subscriber to the YouTube channel. And for those that are on Facebook, for those that are on Instagram, we appreciate you as well. But go to the YouTube channel, AskDrMJ, Ask Dr. MJ, and we will be happy to have you as a subscriber. Okay, so we talked about the topic, but this is the people show. So whatever you would like to discuss. So let's get to our questions. Heidi, let's roll them. Okay, my purpose piece. What can you do to treat nerve damage? We're in PT and have had surgery, but the travel up her back and now having issues. Is there anything progressive that can be done? Damage to a nerve requires the nerve to heal and repair itself. That process can take a while. It can take a few weeks. It can take months. In some situations, it can take years. But the point being, the nerves can regenerate and can heal themselves. So it's very important that you provide the building blocks so that the nerves can do that. Oftentimes, nerve damage is caused by inflammation, or the healing process itself is inflammatory. So you need to use the body's natural anti-inflammatory. 2 things I recommend: vitamin D at 5,000 international units per day, a unique formulation that you will find on our website, lipodrops.com, LIPODROPS, the only site where you can get 5,000 international units of Doctor's D. This is my formulation of vitamin D. You take it daily, and it helps with inflammation. It helps promote healing as well. Also, omega-3 fish oil, again, a very great anti-inflammatory. But if you have problems with fish, there are other omega oils that you can use as well. But our product is centrifuged and purified. When you open the bottle, it does not smell fishy. And when you look through the capsules, it is crystal clear. That's how you know you have a high quality omega-3 fish oil product. And then physical therapy is a necessary because it stimulates the nerve to want to reconnect to the muscles to stimulate them. And that is why you have to have continuous physical therapy, not just when you're at physical therapy. They teach you exercises and certain things to do. So when you're at home Netflix and chilling, you do those exercises. When you're at home doing anything else, you do those exercises. So you don't wait till the 2 or 3 times per week that you're actually at physical therapy. You continue to do those things and you will have a greater outcome. It is a slow and arduous process, believe me. But once you start to see benefit, you will understand the necessity for doing that. And the more stringent you are about the physical therapy, the quicker your recovery will be and the more complete the recovery will be. Okay, great question. Going to the line right there, I said that I have stage 3 kidney disease and I can't reverse it. So what can I do to stabilize it and not get any worse? Thank you. Well, with CKD3, chronic kidney disease stage 3, that can be reversed, but it's usually caused by 1 or 2 things or both: uncontrolled high blood pressure and uncontrolled diabetes. So the primary treatment is to control those disease states that have insulted the kidneys. The kidneys and the liver are 2 organs that have the unique ability to regenerate and repair themselves. One of the simple things that you do to help optimize kidney function is by drinking 8 to 10 glasses of water daily, not counting anything else that you drink. So not coffee, not tea, nothing else counts. You drink in addition to, you still get your 8 to 10 glasses of water. You do that for 3 months, and I promise you, your GFR, glomerular filtration rate, which is what the measurement is that determines what stage your kidney disease is, will improve. I just had a patient today that went from 38 to 48 in the past few months by just doing what I asked them to do. Control the blood pressure and drink the extra water. So they've had 10 points. A normal kidney function or glomerular filtration rate is 60 or higher. So you want to get up at least till 60, but the better you get, and as long as you're at stage 3, you can improve the kidney function. So great question. All right, Holly. What can I use for my skin? I'm type 2 diabetic. I use Dexcom G7 and my arms are dry, small bumps. I tried Cetaphil cream. It helps, but the spots are still there like eczema. You can use hydrocortisone cream. Go to the dollar store where everything's now $1.25. Buy 1% hydrocortisone cream. Clean the skin with alcohol prep. Then apply a small amount, just a small, tiny amount of hydrocortisone cream, and then apply the Dexcom 7. Some people, because of the adhesive that's on the disc, it can sometimes cause that problem. You may find that just switching to the Freestyle Libre may fix that problem. But if you prep your skin that way, and also alternate sites, don't go to the exact same spot, rotate, kind of do a clock face, 6 o'clock, 7 o'clock, 8 o'clock, so that the disc, which is about the size of a nickel, is not in the same space every time, because it has to sit there for 14, 15 days. And so the Dexcon 7 is a 10-day. You get 3 per month, and that is a 10-day disc or sensor. So you can move it more often, and it's less exciting. But make sure the skin is clean. Make sure the skin is dry. Prep it with an alcohol prep. Let it dry. Then apply just a tiny amount of hydrocortisone cream, and then rub that in, and then apply the Dexcom. And that way it should still stick, but it also won't cause that reaction. And that's basically a topical dermatitis. It's a contact dermatitis. Your body's reacting to not the Dexcon itself, but to the adhesive that holds it in place. Okay, all right. Vanessa Spurlock, can I schedule a personal televisit for a treatment question? Yes, you can. Call the office 770-948-5400, 770-948-5400. We can do telemedicine, not a problem. Calvin Rhea, I'm 69 years old, overweight with bad hip. What is the proper way to use your products but have limited exercise? My products are not dependent upon exercise. You do not lose weight in the gym or exercising. You get fit by exercising, but you lose weight by altering your metabolism and by what you're eating from the kitchen. So Dr. Collier's catchphrase, you don't lose weight in the gym, you lose weight in the kitchen. So the products that I would highly recommend for you are the Lipodrops Maximum Strength. They go under the tongue, 1 drop of full, hold under the tongue for 2 minutes, then swallow before each meal. And then the Lipo Nights, which is the product that literally burns fat at night while you're sleeping. It's got 3 different fat burners, as well as melatonin, which allows you to get a good night stress-free sleep, which means no stress hormones, and so no abdominal fat disposition. So that is the 2 things I'd recommend. And again, even though you have a bad hip, your upper body can move. And so if you're moving, the more you move, the better you will be. If you're just sitting there watching television and chugga, you're burning calories. You can use light weights, 5 pounds, 10 pounds, no more than 10 pounds. You don't need to do more than 10 pounds, but 2.5 or 5 pounds will give you the benefit of that. Okay, Zandra Harris, what do you think of the HRT pellets that are placed under the skin? Thank you. HRT, or hormone replacement, is actually bioidentical hormone replacement therapy, BHRT. It's a procedure that I do and perform in my office. I have the BHRT pellets myself. It is the absolute greatest therapy ever invented. It is God's gift. It is the fountain of youth. It takes 20 years off of your life. It makes you look better, feel younger, act younger. It does all kinds of great things. So I highly recommend the BHRT pellets. You can Google or find someone in your area that does the procedure. It is much more common than it was when I first started it. So a lot of doctors know how to do it now, but they make sure the doctor you go to is trained and that you get it from a doctor. There are a lot of people that are not doctors that are doing this procedure now, and you want it from a doctor that is well versed in it. I've done over 1,000 of those. And so welcome for you to come to Atlanta and get it done. That's not a problem. If you're not in the Atlanta area, come on down. I'd be happy to see you. Okay, thank you. Next one, Hailey. Kayshawn Garman. Kayshawn, I love that photo. Thank you so much for your service to the country. Hoorah, Devil Dog, you Marine, you. We appreciate you. Thank you once again for your service. From Atlanta, Georgia, I have several chronic illnesses with cancer, Fournier's gangrene, and diabetes. Can I take Lipodrops? Yes, you can. Lipodrops is perfectly compatible with any disease state. It's compatible with any medication. There's no conflict. All it will do is optimize your health. But we want to talk about the Fournier gangrene. That is associated with using the GLP-1 inhibitor medication. Not the GLP-1, I'm sorry. The medications like Jardiance and Farxiga. Those are the medications that can do that. And that is an infection that causes gangrene in the groin area, right between the sex organs and the anus. That is the area that is affected, and it can kill that tissue and really cause a lot of problems. But the answer to your question is perfectly safe to take the Lipodrops, and the weight loss, whatever weight loss occurs, will help control your diabetes. And vitamin D, very good with a cancer diagnosis. I had a patient today. They say they listen to me all the time, but when we talked about vitamin D and the benefits of it, they were shocked and surprised. I said, you couldn't possibly be a listener of Dr. Collier and not have heard me talk about the benefits of cancer prevention with vitamin D at a therapeutic dose of 5,000 international units per day. Not 300, not 400 that you can find some products for sale off the shelf. Those are a total waste of money, time, energy, and effort. They do absolutely nothing for your health. You need to, at minimum, be taking 2,000 international units. And the most common preparation that's available is 1,000. And now, because people have learned, they oftentimes will say take at least 2 of those. And 2 is good, but 5,000 is the best and most optimal. The decision when you decide to take a medication or a supplement is one, whether to take the medication or the supplement at all for whatever disease state, high blood pressure, diabetes. And then what you want to do is take a therapeutic dose, a dose that will give you the optimal and maximal benefit that you are seeking. So when people reluctantly tell me, they say, Dr. Collier, I don't want to take medication, but if I have to take it, I want you to give me the lowest dose. That's not an obtainable objective. You don't want to take the lowest dose. You want to take the dose that works. So whatever that dose is. So in your situation, Kayshawn, thank you so much for tuning in. You can take the Lipodrops, no hesitation. Go to the website, lipodrops.com, where any of the products that we have there would help. I would highly recommend with that list that you definitely take the vitamin D and that you take the omega-3 fish oil. That combination will help with the inflammation. Everything you have listed there are inflammatory disease states. So how do you treat inflammatory disease states? With anti-inflammatories. Vitamin D, the body's natural anti-inflammatory. Omega-3 fish oil, God's gift to inflammation. Okay, great question. Marissa Jarrett, do you recommend taking collagen for joint health? If so, how much milligrams do you recommend? Collagen is good for joint, but I recommend more so. There's a product called Osteobiflex, which is a combination of 2 things, glucosamine and chondroitin. It is the only supplement that has been shown to actually heal and repair joints. Everything else just calms down the inflammation and does no good. Collagen is great for your nails, but the Osteobiflex is better for the joints. So it's commonly available. The great thing about glucosamine and chondroitin is it's available everywhere. I specifically cite the Osteobiflex because it's only 1 pill or capsule twice a day. There are products with glucosamine and chondroitin that require you to take 6 or 8 capsules a day, and that's a very large pill burden, and most people won't continue to do it even if they start doing it. Okay, great question, Marissa. Okay, Val D, I was wondering, are Lipodrops safer than the more commonly known weight loss drugs, Wegovy, etc.? My weight loss efforts need additional support, but I have been hesitant due to having 1 kidney. Okay, the Lipodrops are safe. The other medications are safe as well and actually good for your kidney health. The GLP-1s, that's Wegovy, Ozempic, Mounjaro, Zepbound. All of those are actually shown to improve. Initially, they thought they would be bad for the kidneys, but what they learned is they actually improve kidney health, and people are getting these medications. They're also getting the Jardiance and the Farxiga to help with kidney health as well. So one thing about the Lipodrops, when you lose weight using one of those GLP-1s, it can cause some problems with excess muscle degradation as well. If you take the Lipodrops, it makes your weight loss 98-99% fat only. So the Lipodrops are a great supplement to GLP-1 therapy, because if you've seen people that have been on GLP-1 therapy and they have a sunken in face, or they appear gaunt or unhealthy because of excess weight loss, but the issue is not excess weight loss, it's excess muscle deterioration. And so products like Lipodrops help stop that from happening. And so it's a good adjunct to the GLP-1 therapy. So I highly recommend that you can add that to your therapy with the Wegovy if you want to try that. If not, the Lipodrops themselves will result in weight loss. That is what they do. Okay, Pam Roy, what product can I take from your website for high cholesterol? The omega-3 fish oil lowers your cholesterol and lowers your triglycerides. So it's a great product for that. But depending upon your level of cholesterol, that may not be the only thing you need to do. But the omega-3 fish oil is 1,480 milligrams per capsule. You take 2 of them, one in the morning, one in the evening, best absorbed with food, but you do not have to take it with food, but it's just absorbed better with food, and that will lower your cholesterol very well. Other things that I recommend, red yeast rice, which is very good and a natural way to lower your cholesterol level as well. Okay. Hi, Nari Strong. Thank you so much for tuning in. Charles Evans, can you take a multivitamin with metformin? Yes, you can. Multiple vitamins. But what you need to take, Charles, is a complete multiple vitamin with iron and minerals. A complete multiple vitamin has everything in it that you need. You want the iron, you want the minerals as well. A multiple vitamin just means more than one. It may be 2 things. It may be 3 things. It may not be, but whatever it is, because it doesn't say complete, it doesn't have everything in it. And you can get everything in one pill. The only thing you can't get enough of is the vitamin D, because it just doesn't, chemically, it just doesn't come together. The pill would have to be the size of a Tic Tac. I mean, the size of a lifesaver, and it would be very difficult to swallow. So you take the vitamin D separately, and you take a complete multiple vitamin with iron and minerals. And guess what? There's no such entity as a generic vitamin. A vitamin is a fixed chemical formula. There's no better way to make it. If you spend more than $10 or $15 for a bottle of 100, you are paying for a pretty bottle and a celebrity endorsement. Okay, there's no reason that a vitamin should cost that much. You can get a very good vitamin. So if you see a vitamin on the shelf that says name brand vitamin, Centrum, Z-Bec, 1 a day for men, 1 a day for women, etc., and it right next to it, Kroger brand, Target brand, Publix brand, compared to 1 a day for men, compared to Centrum, compared to Z-Bec, get the store brand. It's exactly the same formulation. There's no benefit to, and there's no better way to make a vitamin. It's a fixed chemical formula. So save your money. Don't pay for that pretty bottle. Don't pay for that celebrity endorsement. But the great thing about vitamins, almost everybody listening tonight probably has a bottle of vitamins at their home. It's sitting in the cabinet, sitting in the medicine cabinet, sitting in the bathroom, sitting in the kitchen, oftentimes unopened. But even if it is open, it's not dosed daily. The worst medication or supplement that you can have is one that you're not taking. So make it easy to take your vitamin, make it a part of your culture. Wake up in the morning, wash your face, brush your teeth, take the pill. You do not have to eat to take vitamins or virtually any other medication in this day and age, because they know people won't do that. So they coat the medications and the supplements with things that make them easy to digest. But what you have to do is drink enough water to melt that coating. And when you do that, when you drink a full glass of water, how about that? Is that when you drink a full glass of water, it melts the tablet, gets it out of your stomach, into your system in as little as 2 minutes. So make that a part of your culture, that when you take a pill, probably up to 3 with 1 glass of water. 2 is ideal, but 3 is probably pushing it. With a full glass of water, give that a chance to go down, and then you take, if you need to take more, take 2 or 3. If you've seen my video on Dr. Collier taking his supplements every morning, I have a regimen. I wake up in the morning, I rinse my mouth out, I take a pill, I brush my teeth, I take a pill. Each time with a full glass of water, I shave my face, I take a pill. So 3 things that I do in the morning, 3 opportunities to take the pill, and those 3 are Dr. Collier's healthy trio that we recommend, the essential trio for a healthy life. Vitamin D, omega-3 fish oil, and probiotics. Those 3 things I recommend that everybody take every day. Black, white, yellow, brown, male, female, young, old, whatever, and whoever you are, those 3 products will optimize your health, probably add 10 quality years to your life, where you're dancing, dressing well, enjoying life, versus having Alzheimer's disease or infirm from arthritis, not enjoying life, just basically living from one doctor appointment to the next. Those 3 things, the earlier you start, the better your health will be. Dr. Collier's essential trio, omega-3 fish oil, vitamin D, and probiotics. Take them every day. Watch the video. It's on the YouTube channel, AskDrMJ. Thanks, Charles. Great question. Shamika Hall, my 74-year-old mother, is losing weight and blood, and her blood pressure is all over the place. Her weight was 147, is now 98 unintentionally. She has connective tissue, but had it for 15 years without issues. Probably not the case, but she needs a thorough workup, particularly to rule out things like cancers. She needs an upper endoscopy, a colonoscopy, CT scans, MRIs to look for the reason that this is happening, but also check to see if she's eating. Now, you say she's losing weight and blood. If she's losing blood, something's not right. So that means she's vomiting it up, or it's coming out of her vagina, it's coming out of her rectum. Those are the places you would lose blood from that are visible. So that needs to be evaluated immediately. If her weight's come down from 147, she's lost a third of her body weight, and 98 pounds is anorexic and not sustainable. So the connective tissue issue, as you so astutely stated, is probably not associated with this. This is something else. So she needs a thorough and complete workup, needs to partner with her provider, her doctor, primary care doctor, to do that diagnostic testing. With a weight of 98, she might even qualify for being hospitalized. Amazingly enough, they don't hospitalize people these days. They'll have you sitting in the emergency room for a day and a half, 2 days, without admitting you, because they get paid more for doing that. So it is, but she might need to be hospitalized so she can get all these diagnostic tests out of the way to determine to get to the bottom of this. So very good. All right. Belinda Washington, I've heard some very good info on some much needed subjects. I never enough information provided. Thank you, sir. Thank you, Belinda. I appreciate that. Thank you for tuning in. If you're not a subscriber, go to the YouTube channel and subscribe. Ask AskDrMJ. Vanessa Spurlock say, we can take Dr. D on an empty stomach. Yes, you can. The Dr. D, any of the Lipodrops product can be taken on the empty stomach. There are a couple, like the omega-3 fish oil, that are absorbed better with food, but do not have to be taken with food. They will not. So, and I don't take mine with food. When I take it in the morning, I just take it with a full glass of water. Now, it's probably at least an hour before I actually have something to eat in the morning. So it doesn't bother my stomach, but when I take it at night, I usually take it with dinner. So you can do all of those things. Makiba Boulder, Lipo Cleanse and Lipobiotic will help you. They'll be help clean out the system and remove the bloating. She is absolutely correct about that. She has been utilizing both products, and that is what Dr. Collier calls his belly fix. The belly fix, to take care of that bloating, to take care of the foul gas, to take care of chronic constipation. The combination of the probiotics and the Lipo Cleanse. The Lipo Cleanse is not, I repeat, is not a laxative. It does not give you uncontrolled bowel that you have to run to the toilet to address. What it does do is allow you to have large, easy to pass stools. And when you do sit at your convenience, you empty your colon and you have probably a larger bowel movement you ever seen. Can't believe it comes out of you. When that does, it decompresses the colon. Then your stomach is flat. You don't have gas. You don't have burping. You're not passing gas. And when you use the probiotic to change the gut biome, you go from an unhealthy gut to a healthy gut, where when you pass gas, it doesn't smell good, but it doesn't smell foul. It doesn't smell bad. And when you have a bowel movement, you don't care if somebody goes into the bathroom right behind you, because it's not foul. It's just not that, and you aren't foul. Your skin is healthier, your breath smells better, you're more kissable, all of these things, and you have obtained good GI and immune health with those two products. Okay, Nikki Perry Latimer. I've been diagnosed with mild kidney disease over 2 years ago. I've been diagnosed with hypertension over 15 years ago, and recently high cholesterol. Was a good supplement for my kidneys and to lower my cholesterol. Once again, the omega-3 fish oil, the vitamin D would also be good for those disease states. But you diagnosed with high blood pressure 15 years ago. That's why you have the chronic kidney disease that was diagnosed 2 years ago. Your blood pressure is not controlled. You need to control the blood pressure as a primary objective. There is nothing magical on the Lipodrops website that will correct that problem if you don't control the blood pressure. If you do control the blood pressure, again, the kidneys, if you only have mild disease, your kidneys can regenerate and repair themselves, but the blood pressure has to be controlled to allow that to happen. Blood pressure control, then omega-3 fish oil, the vitamin D will be absolutely wonderful for you. Also, depending upon your weight loss in general will help with kidney disease because it's not such a large burden to the kidneys when your weight is more normalized. So the Lipodrops maximum strength formulation may also be a benefit. Okay, great question. Highly. Jewel, hello, Dr. Collier. I'm currently using Lipodrops Max. What other advice can you provide me on losing a good amount of weight at a healthy rate? So using the Lipodrops Maximum Strength formulation, you can use it with one meal, your largest meal. You can use it with 2 meals. You can use it with every meal. It's enough in the bottle to use it 3 times per day for 1 month. So the key thing about the Lipodrops, you have to ensure that you are taking it appropriately, because a lot of people, they get slack with it, they squirt it under their tongue and they swallow it immediately. And when you do that, it does absolutely nothing in your stomach except get digested. It's absorbed and it works. Its functionality is by being absorbed under the tongue. That is called sublingual administration. That is as effective. That is as effective as taking an injection. And so it's literally the same. If you got a shot of B12 or something in your bottom and you put B12 drops under your tongue, the absorption rate is exactly the same. So a great benefit to doing that. So you have to place it under your tongue. You have to hold it under your tongue for 2 minutes, then swallow it. Then you get the maximum effect and will lose the largest amount of weight in the shortest period of time. Other adjuncts, if you like, we have a product called Keto Max, which puts your body into a state of artificial ketosis, just like being on the keto diet. Without being on the keto diet, it helps you burn fat. And then, of course, our greatest product of most recent development, the Lipo Nights, which has 3 fat burners in it that burn fat at night while you are sleeping. You take 2 capsules at bedtime, and it has melatonin in it, so you get a good night's sleep. You do not have the effects of cortisol, the stress hormone that causes abdominal bloating and abdominal fat deposition under the skin and under the muscles, not above the muscle, under the muscle, which is the worst place to have fat distribution. That gives you that pouch, that belly that looks like, for men, you have that you're pregnant. For women, that you have a big fibroid. And so that takes care of all of that. That combination of those 3 things will give you the greatest amount of weight loss in the shortest period of time. If you want to add on just one product, then the Lipo Nights is what I'd highly recommend. So Lipo Drops used correctly, and the Lipo Nights. I've had people that have gotten the Lipo Drops said, they didn't lose much weight as they thought. And then when we reviewed the appropriate technique, all of a sudden the weight loss just took off, because now they're getting it into their system. Before they weren't not getting it into their system. So it tells you directly on the bottle what to do and how to do it. There's also a package insert that tells you what to do and how to do it. So take it out and read it and do exactly what Dr. Collier has told you. Hold it under your tongue for 2 minutes, then swallow it. Great question, Jewel. Joyce Woods, my name is Joyce, and I had breast cancer. I would like to know what type of vitamin that I can take to grow my hair back. Thank you. With hair loss, and that was a part of the therapy for that. Most chemotherapeutic medications and substances attack the cells in your body with the highest metabolic rate. That's cancer cells. That is why when people have cancer, they lose weight and get skinny, because the cancer is taking up all the nutrients to support itself, and your body is not getting nutrients. So once it burns through the fat, you start to lose weight and become emaciated. That is the nature of cancer. Well, the nature of the treatment for cancer is to use chemicals or other adjuvants that attack the cells with the highest metabolic rate. Guess what the other cells with the highest metabolic rate are? Your hair cells. So the hair on your head, the hair, your eyebrows, even your eyelashes, any hair anywhere on your body can be lost. And oftentimes it is an indication, if you want to look at it as a positive, that the medication is working for you, that the chemotherapy is working. It's attacking the cells with high metabolic rate. Hair loss is a common phenomenon. And oftentimes, and most of the time nowadays, the hair will grow back. You just have to support it and allow it to grow. So omega-3 fish oil will be good for that, and vitamin D will be good for that as well. Again, with a history of cancer, you definitely want to take the vitamin D and get that vitamin D level up between 60 and 90, which helps prevent the recurrence of the cancer. And then it also is the body's natural anti-inflammatory. And guess what? Cancer like most disease states, it's an inflammatory condition. So you treat inflammation with anti-inflammatories. So very good. That will grow back. Congratulations on beating the cancer. Sounds like you were well on the way and road to recovery. Vitamin D, Doctor's D, 5,000 international units. You can get it at the Lipodrops website. Go to lipodrops.com and you can get that product, but also omega-3 fish oil, which is God's gift to inflammation in the body. It will help with everything as far as your health is concerned. And it's compatible with any of the products that you may be on. With breast cancer, they oftentimes have you taking tamoxifen as an adjuvant to prevent the cancer from returning. And then you have to be on that for anywhere from 3 to 5 years. So it's important that you take other supplements, but you can, and it's perfectly compatible with those. Thank you, Joyce. Great question. Good luck on your journey. Antoine Parks. I have 3 concerns. 1, what's good for anxiety? Voting for a different president. Number 2, shoulder pain in older adults. The arthritis in the shoulders, which is kind of a common thing. What's good? More asthma, mucus. Thank you. Okay. Allergies are usually the cause of triggers of asthma. And amazingly enough, this connection was not made for hundreds of years. People were treating asthma, but they did not relate it to allergy and allergens, things that are now identified as asthma triggers. So good. You want to calm down your body's immune system. The way to do that, we have a product called Lipoimmune, which prevents infections and mutes the effect of biological triggers, but also the probiotics. Probiotics, God's gift to any asthma problem, any allergy problem. So sinus, allergic rhinitis, itchy, scratchy throat, postnasal drip, reactive airways disease, bronchitis, asthmatic bronchitis, and full-blown asthma, mucus production. All of those things will be muted by probiotics. Probiotics are amazingly good at blunting allergies. Sometimes you're allergic to things you may not know, like foods. I do a blood panel now that literally only takes 1 drop of blood. You can get a finger stick and get 1 drop. I can get 1 drop of blood if I draw a tube of blood for other testing. I take 1 drop out of there and do a blood allergy test that tests you for indoor allergens like moles and penicillin and rats and mice, dogs and cats. Outdoor allergens, every trees, grass, and pollen that's in your demographic area. And then food allergies, common foods, milks, eggs, nuts, fish, pork, beef, all the things that you shrimp. You know, it's a curse. I say number 1 appetizer that we like is shrimp. If you're allergic to shrimp, you can't have shrimp. And so, but it does not necessarily manifest itself with your lips swelling or you coughing and choking, or it just may be that you're not digesting well, or that it aggravates your asthma symptoms. And you hadn't related those 2 things. So you have to make sure that you're avoiding all allergens. I would recommend, Antoine, that you get that blood test. It can be performed at most labs now. You go to the doctor, tell them you want blood allergy testing. You don't want scratch testing. That's expensive and aggravating because it makes you itch all over and all kinds of stuff. When they can get the same information from 1 drop of blood and tell you what to avoid, what not to be around. If you might have a pet that you're allergic to and don't even know it. Most of the time you do, but you need to know that. But foods, the most common underlying issues with this are food allergies, and people don't know that they're allergic to these various food products because they don't have any bad problems. Maybe it's a mild indigestion when they eat certain things. Let's say you're allergic to eggs and you get a salad with eggs and croutons on it. And then you have beef or pork or salmon or tuna or some other fish product that you're allergic to. And then you have strawberry shortcake for dessert. You're allergic to strawberries. So you got 3 major food issues and you've taken in all, and the combination of those 3 at minimum will cause problems with digestion. At maximum, sinus drainage, sinus congestion. You feel like you're coming down with a cold. Your nose starts to get stopped up for no apparent reason. You get itchy skin. You get eczema changes on your skin. Or you have a full-blown allergy attack, an asthma attack. So all those things are things that I recommend. If you have not had them with those diagnoses, you need to have that checked. And the shoulder pain, again, omega-3 fish oil literally oils the joints and makes the joints feel much better. And part of that, too, is because it's anti-inflammatory. And guess what arthritis is? It's inflammation of the joints. Itis means inflammation of, like appendicitis. Itis means inflammation of the appendix. Arthritis is inflammation of the joints. And so if you calm down the inflammation, the joints feel better. Passive range of motion of the shoulder joints, also very good. I start off with putting your hand on your belly button and rolling your shoulder like this. You can do that while you're watching television. I say every time a commercial comes on, you just do that. You're rolling your shoulder, rolling your shoulder, rolling your shoulder, rolling your shoulder. I'm trying to get it, but you can see it. Rolling your shoulder, rolling your shoulder. Now, next, you do this. Chugga, 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 chugga. Like this. Then you're going to graduate. You're going to go 360. You go up, back, and forth, back and forth. Then you're going to go back and forth with a 2-pound weight, 5-pound weight, no more than the 10-pound weight. Before you know it, you got full range of motion in that shoulder, and it's not a problem. But you start off with the chugga, 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 chugga. Then chugga, 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 chugga. And this is not all in one day. This is you start off doing this for a few days, then you start off doing this for a few days, and then you start off with the weights going 360. And when you do the 360, start off with the light weights. Even though you may be capable of carrying heavier weights, it's not necessary, and it actually causes problems with your muscle spasms in the shoulder. So you want to do frequent lifting of lighter weights until you build up to a heavier weight that will help that shoulder. Okay, thank you. Highly, let's go. Angela Hill, good evening. Does the Lipodrops make you lose weight all over or just belly fat? I really want to lose my belly fat. So Lipodrops makes you lose fat from where you have fat. But it also makes you lose fat from places you cannot traditionally exercise away from, like under the chin, across the back in the bra line, the bulging under your arms there, the belly fat, the inner thigh, the outer thigh. So wherever you have the fat is where that fat will be metabolized. And so if you have more fat in the belly, you will get that. But let's be clear, there's no targeted something that's only for the belly. Unfortunately, there isn't. We do have a technology for that, the strawberry laser lipo, which is like liposuction without having to have surgery. It is incredible technology as well. And I'm looking at your screenshot there. It don't look like you have a lot of fat to lose. So if the only fat you have to lose is in the belly, that's where you'll lose it from. So it doesn't make you lose muscle. So it will target. I think you'll be happy because you'll get the weight loss from the belly that you like. But the Lipo Nights would probably be the best product in combination with the drops, or just the Lipo Nights by themselves, because those fat burners will concentrate more on abdominal fat than anything else. Go to the website, lipodrops.com, LIPODROPS. Look at that Lipo Nights. That is our best-selling product right now. Everybody loves it, and it works amazingly well. Okay, P. Murphy. I have multiple sclerosis and high blood pressure. What medication would you suggest I take? For the high blood pressure, the class of drugs that I like are angiotensin receptor blockers. The most common are losartan and olmesartan. Benicar is the name of the olmesartan, and the losartan is Cozar. In combination with diuretics, Cozar becomes Hyzar. Olmesartan is just olmesartan HCT. That would be first choice. Second choice would be adding a dihydramine calcium channel blocker. That would be a product like Procardia XL or amlodipine. What those do is dilate the artery. So if you have an artery this big with a certain amount of blood in it, and then you take that medicine, it makes the artery this big. So you got bigger pipe, same amount of fluid, less pressure. The benefit of that is the mechanism of erection is one of blood flow. So now you have larger pipes. So that class of drugs, if you want to call this a side effect, makes your erections longer and harder. Now, nobody ever complains about that to Dr. Collier. Oh, Dr. Collier, that blood pressure medicine makes it too long and too hard. They don't complain about that. So that is one of the great things, and it just requires a knowledge base from your provider that they give you a medication that will give you great benefit and not a side effect that takes the lead out of your pencil. Okay, so for multiple sclerosis, they have great biologics now that are oral and injectable. And so you have to take one and try several and see which one gives you the most benefit. They have injections that you take weekly. They have injections that are monthly. They even have injection now that's quarterly. But they also have a lot of these injectables have been converted to oral forms, the pills that you take every day. So they're a new technology for the treatment of multiple sclerosis, and that is a autoimmune disease that deteriorates muscle function and nerve. Again, but can be treated and get great benefit from. So talk to your neurologist about some of the current breakthroughs that they have in the treatment of multiple sclerosis. If you've been on the same product for more than 5 years, you probably are behind the times because they've had great breakthroughs in the last few years. If you've been on the same product for more than 10 years, you definitely are behind the times. So you need to just, again, because that's what you've always been getting, if you don't complain about it or ask for something different, they'll just keep writing that same prescription over. They say, how you doing? You doing okay? Yeah, you having any problems? No, prescription gone, next patient. So make sure you have that conversation because this is a chronic disease state. It requires you to have a partnership with your provider so that on each and every visit, you are assessed as to how, whether the medication is working at all. If it is working, how well it is working. It did work. Is it still working? Is there now, are you becoming what's called tachyphylaxis? That means the medicine, your body gets used to the medicine and it's not working anymore. It doesn't work as well. So you want to make sure that that is not the case with you, that it's still providing you with optimal benefit. The problem with MS is that the deterioration is slow and steady, and you may not even appreciate that you're worsening or that you're not quite as good as you had been because of that. So you want to make sure that this requires a constant exchange of information between you and your provider on a regular basis, and you need to be seen no less than every 3 months because more than that, then things can be missed. Okay, Telia Starks, hello, thank you so much. Antoine Parks, thank you, Antoine, we appreciate you. Hi, Antoinette Campbell, watching from Montgomery, Alabama. Thank you for watching from Montgomery, Antoinette. My question, I do the fish oil, probiotic, and vitamin D. I also do a multiple vitamin along with B12. It's too much to take with iron supplements. If you're taking a multiple vitamin, you need to get a complete multiple vitamin with iron and minerals. With iron and minerals, and then you don't have to take additional iron. Now, understand this, most women of childbearing age that have menstrual cycles are anemic because they bleed during their cycle and they never eat enough of the foods to replace the blood that they lose. So over time and over years, they become anemic. And so they stay anemic until they either get pregnant, they're placed on prenatal vitamins, or they go through menopause. So the anemia is almost a chronic condition for most women, disproportionately affecting women of color. So make sure that you're taking a complete multiple vitamin. Ones I recommend, one a day for women, Centrum, Centrum, or Z-Bec, Z, capital Z, BEC. Those are just name brands. What is important is that the label states that you are taking a complete multiple vitamin with iron and minerals, and you'll get enough iron to keep your blood steady. If you have excessive bleeding, heavy menstrual cycle, then you need to address that because there are medications that you can take that will stop you from bleeding totally, or that can slow it down tremendously. Or if you have a fibroid issue like that, that needs to be addressed. That is the most common, not the only reason that women are anemic, but it is the most common menstrual flow. So we want to make sure that you are taking, but the answer to your question, a complete multiple vitamin, you might not even have to add B12 because most multiple vitamins do have enough B12 in them. And you probably don't need to take iron supplements. Iron by itself can be extremely constipating. So you need to make sure that if you are taking iron, that you're drinking enough water and that you have enough crunchy fruits and vegetables in your diet so that you don't get constipated. Because once that happens, you don't want to take the iron anymore. And it's not the iron's fault. It's done what iron does, which is constipate you if you don't drink enough water and have enough fiber in your diet. Great question, Antoinette. Okay, let's go to Vanessa Spurlock. Is it okay to take the lipohers at night with magnesium, glycinide, Zyrtec, and my sleep supplement? Yes, again, the lipohers and any of the products are perfectly compatible with anything else. But my point being, the lipohers can be taken anytime after dinner. You don't have to take all of those things at one time. You can. But if you want to stretch it out so that each one has a little stomach time by itself, that will enhance the absorption of all of them. And so again, your nighttime routine as you're preparing for bed, you change your clothes, you take the lipohers, you brush your teeth, you take the magnesium, you rinse your mouth out with other things that you may do as part of your nighttime preparation to go to bed. And you can take, as long as they're 2 to 5 minutes between each dose, you can separate them. But the answer to your question, is that yes, all those things are compatible. You can take them all together. There won't be any contraindications or drug interactions of significance. So you shouldn't have any problems with that. Okay, great question, Vanessa. Mia's how to treat lymphedema. Oh boy, that's a great question. Lymphedema is a problem. It is a chronic disease state where you can get swelling. It can be minor, just of your feet and ankles. It can be all the way up the legs to the buttocks. And so the problem with that is dysfunction in the lymphatic system of the body. So there are treatments that are constant because you can get therapy that will reduce the edema, and then a week later it's right back because you have to keep a negative pressure on those extremities because the fluid collects by gravity. Which is why it's usually from the hips down. And then you've seen people with edema of their legs and their feet. If it's just their feet, elevation helps tremendously. A low sodium diet, then over the calf men's support socks. Once it get out of control, you have to have compression socks. Compression socks are unattractive physically. They don't go with anything you're wearing. They're difficult to get on. They are very difficult to get off. And so most people stop wearing them or they don't like wearing them. And oftentimes, depending upon how severe the edema is, they have to be custom developed. You have to wear some that will fit your oversized limbs. So in doing so, now there are other lymphedemas associated with things like if a woman has a mastectomy, she can get lymphedema if they remove the lymph nodes. And so you may see one arm that has lymphedema. They will usually give a compression sleeve to put on to keep that under stress. But the most common edema is of the lower extremities. And again, Dr. Collier wears over the calf support socks every day. I have every color that goes with every outfit, every scrub, every dress outfit, whatever. But they come up over the calf. They have, let me come this way. They have ridges that compress the skin so there's no space for fluid to accumulate. So at the end of the day, I don't have fat feet and fat ankles. And so my objective is to not have to deal with varicose veins, not have to deal with, swollen feet, swollen ankles. One is unattractive, but ultimately develops in circulatory dysfunction that can result in everything from blood clots in your legs to just pain discomfort. And there are surgical procedures that can help correct that, but it's best not to get them in the beginning. So I tell all my patients, male and female, to wear men's over the calf support, SUPPORT socks over the calf, meaning they come up all the way to your knees. I tell the women to wear men's because there's no difference in men's socks and women's. Men's socks are just cheaper and last longer. There are women's versions, but they're much more expensive and fragile. If you have nails, you can rip them. And if you've ever had support stockings on, you rarely get to wear them more than once or twice because your nails will rip them and they will run, and then you don't want to wear them. Men's socks will last forever. You can get any color. They can be thin enough to appear more feminine. The ones I just demonstrated are athletic level, so they're a little thicker. But I have them in dress sock capability. So when I have on a suit, I'm looking dressed, and they are. But again, over every day. I have had short socks, I call them anklets, that come up midway to the calf. They always cause compression. They always put a line around just below my calf, going down the lower leg, where they're cutting off the circulation. And so the problem was those were the attractive socks. Those were the designer socks. Those were the socks of various colors. But now you can get over the calf socks in virtually any pattern, any color, solid, decorative, whatever. Go on Amazon and Google. Get a few pairs, see which ones you like. Then once you find a style and a brand that you like, just order enough so that that's all you wear. If you're not wearing over the calf socks, you need to wear anklets, something that doesn't cause that mid-calf tourniquet effect. And so anklets just barely come out of the shoe. They protect your feet inside the shoe, but they do not give you that compression that you're looking for, but they will prevent you from getting the swelling below the top level of the sock because the band of the sock is cutting off your circulation. So that's the final question. I want to thank everybody for tuning in. I humbly, once again, thank all of you for becoming subscribers to my YouTube channel. If you are on tonight and you have not subscribed to the YouTube channel, go to the YouTube channel, AskDrMJ, Ask Dr. MJ, where there are hundreds of videos on a variety of topics, Every topic that we're talking about tonight will be archived and videoed and placed in the video. But we have videos from every time I make a presentation, every time I'm on the Rickey Smiley Morning Show, every time Dr. Collier speaks publicly, which is very often. It is taped, and those tapes are cut into 2-minute segments, 5-minute segments, 15 minutes, half an hour. It depends on various topics, but they are there for you to peruse. And you go, if you have a question, the answer is probably on the YouTube channel AskDrMJ. Thank you so very much once again for being here tonight. We greatly appreciate you. Thank you, Holly, for being the producer of the stars. We appreciate that. And as we take it home tonight, we want to thank each and every one of you for tuning in. We had Chicago, we had Alabama, we had Mississippi, we had Florida, we had Atlanta, Georgia, of course, Dr. Collier's home. We had St. Louis. So people from everywhere, thank you for tuning in. We know you got other things you need to do. And remember, ask Dr. MJ why, because your health is important, and we'll see you next time. Next time, we're going to do sex in the 50s. Tell all your friends about it. It is a hot topic. If you're in your 40s, in your 50s, in your 60s, we're going to tell you not only should you have a great sex life, but we're going to tell you how to optimize your sexual function. All right, we'll see you then. That will be airing on September 27th. Sex in the 50s. Sex in the 50s. August 27th, rather. August 27th, Wednesday, 6:30 p.m. Sex in the 50s. Tell all your friends. It is the greatest show of all time where you, male and female, find out about how to optimize your sexual health. We'll see you then. Thank you so much. And thank you. Subscribe to the YouTube channel. Ask Dr. MJ. Ask Dr. MJ. And go to the website, Lipodrops.com, where you can find supplements that can optimize your health.